This is one reason why babies and kids and teenagers sleep so much, is there's a lot of growth hormone release, and we tend to grow. That is, the tissues and limbs of our body tend to grow during sleep. Now, it's been well documented that after about age 30, which is typically when people experience their full stature, their full height, although sometimes there's a little bit of wiggle room around that age, typically after 30, the amount of growth hormone that's released each night and throughout the day is reduced by about 15% for every decade of life. As a consequence, all of the things that growth hormone does, like encouraging higher metabolism, fat loss, the growth of muscle tissue, etc., is dramatically reduced as we go from 30 to 40 to 50 and on and on. It's also the case that naturally released growth hormone tends to have positive effects on our mood and overall feelings of well-being. So it's also tied to our feelings of vitality or having feelings of energy to do things. And that's because growth hormone potently increases ATP production, which is involved in energy and metabolism in our cells. And as a consequence, our overall feelings of energy to just do things, mental or physical. Now, there's another hormone called IGF-I, or insulin growth factor 1, which is produced by the liver. Insulin growth factor 1 does many things similar to growth hormone, and it actually is released in response to growth hormone. So basically the way this works is that there's a signal that comes from the hypothalamus called growth hormone releasing hormone, and then that signal stimulates the anterior pituitary to release growth hormone. Growth hormone then is circulated throughout the blood. It also can access the brain itself. And it does different things in different tissues, but again, increases ATP production for energy. It is going to cause tissue repair in some cases. It's also going to encourage growth of tissues, not just muscles, but other tissues. And that's why it's involved in helping us achieve our full height, our full stature. When growth hormone reaches the liver, it stimulates the release of IGF-I, which in turn does a number of things that are both synergistic and different. That is, it works both similarly to growth hormone and does some things in parallel that are a little bit different as well. In particular, things related to regulation of blood sugar metabolism, etc. All things associated with kind of youthfulness, vitality, and energy.